It's time to talk assessment process. When a client comes to see an RMT for the first time, part of the initial interaction that sometimes occurs before treatment is an initial assessment. The initial assessment helps an RMT develop more of an idea of what to focus on during treatment, creating a more specific picture of what might be going on in the body to cause pain or discomfort before any manual work is done. This can also help to rule out more serious options that would cause pain or discomfort. The assessment process typically consists of 3 parts: postural or gait analysis, range of motion testing, and orthopedic testing. During postural or gait analysis, the client will either be standing in front of the RMT while the RMT observes natural resting position, or the client will be walking up and down a hallway or space while the RMT observes natural walking position. While the RMT observes, they will be taking notes for the client's file, documenting anything they might see. The RMT might observe one shoulder lower than the other, one hip higher than the other, one hip might drop while walking, the legs might bow in or out, to name a few. All of these are indicators of postural habits. If you work at a desk and lean to one side in your chair, which arm you might write with or use more often, a muscle weakness that leads to a hip drop, or if your kneecaps aren't sitting properly in the knee joint due to the bowing legs and may be causing knee pain. Range of motion testing comes next and can be done actively, passively, or with resistance. The RMT will have the client actively move through all ranges of motion, and any range done actively with difficulty or pain will then be tested passively. The RMT will then have the client in a resting state, either lying down or sitting. The RMT will move the client through the difficult ranges, making sure the client stays as relaxed as possible. If there is no pain or difficulty in passive range of motion, the RMT will have the client actively go through the range with slight resistance. This means the RMT will apply gentle pressure in the opposite direction. This type of testing aims to isolate a specific muscle or muscle group that might be causing the pain or difficulty, or determine if the problem is coming from elsewhere. Finally, orthopedic testing can be done to further specify the problem. Orthopedic tests are done to recreate pain or symptoms experienced. Orthopedic tests can be performed on muscles, tendons, ligaments, meniscus. They can be done to check circulation, nerve involvement, or compressions. All tests are done to both sides, checking the unaffected side before the affected side to acquire a baseline for the client's personal state of normality. These tests isolate individual muscles, tendons, ligaments, etc., to pinpoint precisely the problem causing the pain. Registered massage therapists are required to learn 150 orthopedic tests and know the full assessment process in order to graduate and pass their registration exams. Not all RMTs will do full assessments every day in their practice. It all depends what avenue of massage therapy an RMT decides to take. RMTs who practice in a clinical or medical capacity will more often perform initial assessments, and any client is more than welcome to ask their RMT for an assessment even after the initial assessment.